When patients hear they need liver, pancreas, or bile duct surgery, one of the first questions they ask is, "Doctor, can it be done laparoscopically or robotically? Or does it have to be an open surgery?" In this video, I'll break down the differences between open, laparoscopic, and robotic approaches, their pros, cons, and how we decide which is the best for each patient. Hello, I'm Dr. Kaival, a GI and HPB surgical oncologist. I specialize in cancers of the pancreas, liver, bile duct, and peritoneum. Today, I want to simplify a question many families ask. What is the difference between open, laparoscopic, and robotic surgery? And more importantly, which one is right for you or your loved one? Open surgery, the traditional approach involving a larger incision to directly access the organ. Laparoscopic surgery uses a camera and long thin instruments through small incisions. Robotic surgery is similar to laparoscopy, but the instruments are controlled by a surgeon at the console, offering 3D vision and wristed instrumentation. Open surgery allows direct access and visibility, useful in very complex cases, widely available everywhere, larger incision, so maybe more pain, longer recovery. Higher risks of wound-related complications. Laparoscopic surgery, smaller cuts, lesser blood loss, lesser pain, faster recovery, and better cosmetic results. Instruments are rigid and movements are limited. 2D vision may make delicate suturing challenging. Robotic surgery, you have 3D magnified vision, wristed instruments with greater dexterity. It is ideal for fine suturing and operations deep in the abdomen. Increasingly used for complex reconstructions like the bile duct joints, that is hepatico-jejunostomy, and pancreatic anastomosis, just pancreatico-jejunostomy, is expensive, requires specialized equipment and trained teams. Longer setup time, not necessary for every case. Open is still the standard for very large liver resections, complex Whipple operations with major vessel involvement, or when reconstruction is extensive. Laparoscopic is excellent for gallbladder removal, small liver resections, distal pancreatectomy, and diagnostic staging. Robotic is increasingly chosen for complex reconstructions like the bile duct joints, this hepatico-jejunostomy and pancreatico-jejunostomy, selected pancreatic resections, and technically demanding liver operations. The choice isn't just about technology. It has to be tailored individually on a case-to-case basis. It depends on the location of the tumor, size of the tumor, whether major blood vessels are involved, the patient's overall health and recovery goals, the surgeon's expertise in each of those techniques. In HPB oncology, safety and cancer clearance always come first. The best approach is the one that gives the highest chance of complete removal with the lowest risk. I often tell patients there is no one-size-fits-all answer. For some, open surgery is the safest. For others, laparoscopy or robotics may provide the same cancer control with a smoother recovery. What matters most is being treated in a center with the experience and the full range of options. To summarize, open, laparoscopic, and robotic surgeries are three approaches with different strengths. Open offers maximum access, laparoscopy gives faster recovery, and robotics adds precision for selected cases. The right choice depends on your tumor, your health, and your surgical team's experience. If you found this breakdown helpful, please share it with others who may be facing surgery. And don't forget to like, subscribe, and follow this channel for more in-depth explanations about pancreatic, liver, and bile duct cancer care.